Welcome back, everybody. Just about 6 minutes to 9 o'clock this Friday morning. You know, we've all read the reports about the dangers of tanning beds. We've reported them to you many times here on Fox 25. But young people, especially teenagers, apparently don't seem to be getting the message. Meghan Rothschild joining us now as a melanoma survivor herself. You and yourself, Dr. Travers, a dermatologist, both travel around New England teaching teenagers about the dangers of tanning. I want to start with you, Meghan, because your story is so compelling. At what age did you start tanning?
I started using tanning booths around the age of 17. Just like any other young teenage girl, had a lot of body image insecurities. And so I started using tanning booths because I was actually never able to achieve a tan outdoors. And I was finally able to get a tan from those tanning beds.
And then when you were 20, you got the wake-up call.
I did. I noticed a suspicious-looking mole on my abdomen that it started to itch, started to get really dark, and I just kept noticing that I was scratching at it. And pointed it out to my doctor and really kind of demanded to have it removed. And it was 2 weeks later that it came back as a melanoma diagnosis.
Wow, wow. You know, as I was watching your video, which, by the way, we'll tell you how you at home can watch that, I was just stunned. You described going to a tanning bed just after getting that growth removed because you were sort of addicted in a way.
Completely addicted, and certainly never in a million years thought I was going to be getting a cancer diagnosis at the age of 20. So yes, I went in, I had the mole removed, and I drove directly to the nearest tanning salon. And I remember that because I remember thinking, oh, I'm going to have a tan line from the steri strips from this little surgery. So my mentality was anything but logical. It was the typical, you know, I'm indestructible teenage girl mentality.
And now you want teenagers to learn from your mistakes. You travel around New England. Last night you were just in Worcester. Yes. How do you convince teenagers to stop tanning in beds?
You know, it's a tough audience, but certainly I mix it with a little bit of facts. You know, melanoma is the second most common form of cancer for young people ages 15 to 29. The minute we say that to students, they kind of look at us and go, this cancer is affecting me, this is my age group. Then you couple that with a personal story. When I talk about being diagnosed sophomore year of college, they really do listen. They tune in.
Yeah, it certainly is stunning when we hear your story. Dr. Travers, some recent studies, for instance, in the JAMA Dermatology Journal, reveal that young people basically are ignoring the risks. What
I think that's a really hard message to get across because intellectually they understand. They know the information, we give it to them, and yet they're still persisting in these kinds of reckless behaviors. And so it goes beyond simply educating them about what the risks are. It needs to sort of get at why they continue to pursue these behaviors socially. This newer study reveals that a lot of them are seeking out the relaxation aspects of the tanning salons, the social aspects. They often will go together as a group, as a tanning group once a week to get together as a way of relaxing socially with their friends. So I think simply giving them the information about the dangers isn't enough. We need to address that, the relaxation and the social aspects of this as well.
Gotcha. And some of the patients that you've seen are very, very young, right?
Yep. We definitely, unfortunately, diagnose melanomas in very young people and very often in very young women. We're seeing it at epidemic levels among young women, which is really scary, and it very much can be attributed to tanning bed use.
So, listening to this, one might jump to the conclusion, okay, if you tan once a week, as Meghan did, then you're at risk. But a lot of people perhaps would go to a tanning bed a few times before going on vacation thinking, oh, I'm just going to get a base tan. Is it ever okay?
It is not. It is not. When you get a tan, that's your body's way of saying, help, I've been damaged and I need to protect myself against further damage. So the tan does confer some protection against future UV exposure, but in fact it's a response to damage that has already occurred. So no tan is a good tan. Unless it's a fake tan.
That's what I was going to ask you. That's what I was going to, because you still, you know, this is something, as we were discussing before we came on, that is kind of ingrained in our beauty ideal. So when you get these teenagers, they're going to prom, they're going to an event, they want to look their best and have that healthy glow, what do you say to them?
You know, personally, I've tried every sunless tanner on the market in an effort to, like Dr. Travers was saying, you have to give them an alternative because there's a behavioral component to this and a social component. And so, you know, I always advocate for the sunless tanners because it's really just, it's a safer alternative to baking yourself with the UV rays.
Hey, look, let me just put it out there. In the dead of winter, This is from a bottle. It's okay, you know?
Which is great.
Yeah,
Which is great.
Keep it coming from the bottle.
Hey, thank you so much for joining us this morning. Really a powerful message from both of you. Meghan and Dr. Travers, thanks a lot for being here.